is we are the last people in the value chain, the reinsurer, and we are GenRe, and we cooperate with lots of Insurtech around the region and worldwide to promote wellness and preventive. So basically, the beginning, what we try to portray is basically how to go from traditional, because the insurance industry is very traditional and Insurtech is very innovative. So how to go from companionship, from tradition to companionship to a company, within the ecosystem of hyper-personalized product. So we saw many case studies here today that have success stories, and we'd like to well, it's when the things start.
So this is a different kind of approach from what we've seen before, because you as a reinsurer are in different position of the value chain. You certainly have lots of data, a large amount of data you can rely on when you come up with the different use cases you would like to approach, and maybe now it works. Well, otherwise, what you can tell me right from the scratch is why Activolabs was a good partner to approach one of the pains you've come up with and identified within your organization.
Okay, like as far as GenRe, since we're a global reinsurer company and top 3 around the world, we do have lots of, as you said, data, and also a lot of insurance company with whom we do lots of product design and development. And when you have in different region like Activo, we did a very good cooperation agreement in Asia. And we look at we saw also some of the colleagues earlier said that they have failed, and you said, well, good enough.
Well done.
So definitely failure is a good thing in this domain. And we did try several, cooperation agreement with Insurtech to be able to promote them. However, the thing is that we are traditional, and when we tried at the beginning in our journey to cooperate with Insurtech, if you own them, if you own Insurtech, you stop the innovative approach. And so basically the collaboration and cooperation with a company like Activo would promote, first of all, they are like free-spirited and they continue in their growth and development and innovation. And we are looking at it from a traditional standpoint and try to also meet them in halfway and to become, a partner in the journey.
Oh, this is something we take for granted, and if you explain that in a room full of intelligent people, everyone would agree. You kill the innovation once you buy out the different solutions. Nevertheless, in the real world, it happens nearly every day. So, and this is a good use case where you didn't do that. Would you just briefly introduce us the solution for us to understand what is the value you provide to the reinsurer, and we can maybe take it from there. I know you prepared the presentation, it's not working, so let's just try to improvise in that way.
Right. Thanks, Alex. And again, thanks for the opportunity to present our collaboration here. So at Activolabs, we are a digital health sciences company. We focus on real-time data, aggregating real-time data from any and all IoT-enabled sources, turn that data into intelligence that can be used by populations to understand the risk of various health conditions and how they can go about preventing them. And as a business, we are B2B2C, so which means we do not have a direct-to-consumer channel. We work primarily with the reinsurance companies, life and health insurance companies, companies in the employee benefit space, banks, anyone willing to have a conversation with their end consumers around health and longevity using a digital-first approach, we can definitely partner with them. Now, the reinsurance journey, I think with GenRe, it started a year and a half back. We've been speaking to their team, both in Cologne and also in Asia, in terms of coming up with innovative solutions that they can provide to their cedents, right? It all stemmed up with a conversation that started a year and a half back at Insurtech, a similar Insurtech conference in Singapore, where the conversation was about the changing nature of risk itself. And how can we, with data, do a better understanding of how do we price things like what is the cost of risk of climate change on health populations? How do we do that, right? So the main piece is how can we track data from lowest common denominators across populations, from smartphones, from fitness trackers, and try and see that if those kind of data can be proxy for long-term health risk. Yeah. So that's what we do. And yeah, very excited about this collaboration. Some very exciting things happening in Asia already, and in the Middle East with under Mazen and Bashir's guidance. I'm looking all for it. But I think we finally have the slides up. Maybe
Got the
Mazen,
presentation. We're gonna dig deeper into the collaboration thing, but
I'm
go
not
ahead.
going with the presentation because we've spoke about some of the issues. I just want to have the audience participate in one thing. Basically, if you have your mobiles, what are the 6 most expensive words put together in a sentence that constitute the most threatening attitude to an organization? So I know we don't have much time and we just want to be like a bit efficient. If you can scan the, the QR code and then answer just like very quickly, just gonna take a minute. And while you're doing that, I just want to allude to something very important. What we spoke a bit about is the culture and the attitude of company. And the answer to this question would certainly point out to like what would be a successful way of adaptation. Because I think if you look at the S&P 500, 89% of the company who used to be in the early 90s do not exist anymore. So the one who exists, who stayed in this domain, are the one who are able to adapt. So when you are in the value chain, are the company who are able to adapt are the companies who will be successful in the future. One thing about Insurtech, when we started this in this field, we thought that Insurtech. Let me just put some of your answers. If you have like more people like have more answers, have only 4 who replied. We thought that Insurtech would be like a competitive to insurance. At the beginning, the perception of Insurtech was that they're going to compete with us and they will place insurance. And after a few years of like collaborating and cooperating, we found out in the value chain the Insurtech play a major role of, let's say, automate things, make it faster, make it more credible, and use data appropriately. So basically, okay, so we see abuses, rejected, ever 17, the most expensive word. Okay, I'm gonna risk breach. Okay, it's interesting. All right, so basically I will move to what is the 6 most expensive words in a company. We've always done it that way. That's the very killer to any company. So the adaptation and change and going and investing and failing and succeeding is a key success point for any Insurtech going forward. I'm not gonna go through that. Basically, this is the value chain and this is where we sit on the green side. So we are the last people, and then of course, AI has been enable us to transform our day-to-day operation into becoming more hyper-personalized to our customers. And going forward, basically, we do invisible underwriting with company like Activos and personal cover, wellness, customer engagement. So the future is, and I'll leave to Bashir a few words.
Hello. The future is the AI will impact the system operation. So the full chain will change. Chatbot will replace human calls, call centers, and everything. We'll go to customer experience. We have a huge database. The huge database will be personalizing each member on its own. To go to claims processing, WFA, which is in health, WFA is #1 where they detect any abuse in the value chain, and the behavioral economics. The behavioral economics is very important in the chain of the insurance company. And this will impact automatically the efficiency, the cost reduction, the efficiency and cost reduction on the value on the customer and the customer experience. This will automatically go to the premium. This will reduce directly the premium. We will have innovation and competition, which will drive automatically and quickly the future of AI. And for sure, we have the regulatory and ethical consideration, which now we have the #1 law on AI with the UN. So, and to move forward quickly, thank you. We will have data collection. We have input sources from mobiles, apps, wearables, anything. The AI will automatically do a analysis on those and do a segregation into baskets of people, where each basket of people will detect the future health, chronic or severe cases. We will go to chronic disease management, where we will have through this data the chronic cases, where the AI will also determine a care plan for each of those baskets or each of those person. And there we will go to gamification and engagement, where the gamification and engagement will go the AI will directly tackle the physical behavior of each member, which will gain more rewards, more challenges, and we'll go to wellness program where nutrition and mental health, which are two main topics into healthcare system. And will insurance adjustment, I think this is the most important thing before to go all of those, where the premium, we will adjust the premium directly from those four topics. We go directly to the adjust premium, open or close benefits. So either we open dental or we close dental, we take out the deductible or we close the deductible. And for sure, the feedback loop. The feedback loop is just to enhance the full ecosystem of the healthcare. Now I will go to Gurab, which will show one pillar.
Thank you, Bashir. Maybe I'll just quickly take how all those pillars come through and where Activolabs plays its part. I'm going to skip in all the slides because I just did a quick introduction of who we are as well. But the problem statement, as you can see, that is the heat map of chronic diseases in the world. It's not just a developing country problem; it's a global problem, and something needs to be done and addressed quite significantly. I'm going to skip the slide as well. A fairly good the global footprint right now, and Middle East and this part of the world is something that we're super excited about and fairly long. So quickly jumping into how all those pieces which Bashir presented, how they come together. The first thing is that you have to look in terms of removing as much friction as possible in terms from your data capture experience, and that's where you have to look into the lowest common denominator, which is a smartphone. In a developed market or in a developing market, it can paint a very good snapshot of how much you move, with what intensity you move, how much you do not move, and how much you sleep can also be picked up. You have to be device and hardware agnostic, so whether it's a Fitbit, a Garmin, an Apple Watch, you have to include all of them. The third and the most important piece is that explaining to the Jane and Joe on the street what is the meaning of all that data. Your resting heart rate, your heart rate variability, your deep sleep, calories burned, steps taken. What does it mean if you're not a doctor or a sports scientist? So in our research, we figured out that the best way to talk to a population about risk, which is multifactorial in nature, is to do it through a composite scoring mechanism. Just like the financial services industry, they do it with a credit score. So we tried a similar approach, but the thing is, for a score to mean something, it has to predict something. And unfortunately, the antithesis of health and longevity is death and disease. And that's what we're trying to predict based on how much you move, how much you do not, how much you sleep, contextualized to age and sex. Can that be a predictor? What we have seen that it is actually turning out to be the case. We have created the models first on the CDC data sets, and then we have gone on to show that our models also work in other biobanks, whether it's in the UK, whether it's in China. And this is the part that we have really applied, that is the secret sauce. How you take in that data, how you harmonize that data. What is an Activo score for a user who's just wearing a Fitbit versus someone who's wearing an Apple Watch versus someone who's generating the data from that Android device? So that is fairly AI 101. And the third piece is being able to predict something at an aggregated level itself. What is or what percentage of risk in this population, say for clinical depression, you can capture that data at an aggregate level, and that's where intervention really, really happens. And from a score, not only the most important thing are the digital journeys. Without consumer uptake, none of this actually happens, right? Without the users using it, the data does not come in. Once you understand the score, we have the various pockets that actually takes them through the deeper and deeper journeys, all the way from keeping a healthy population healthy to managing something like hypertension and weight loss. I'm going to skip all the slides just to show you one aspect of how this moves. This is a paper that we are going to publish very soon in collaboration with King's College London and University of Oxford. This is on a 500,000 population in the UK. This is the SHAP value. Basically, what it means is that higher Activo scores, there's absolutely no prevalence of diabetes, and you're seeing the same thing on hypertension as well. This is where partners like the GenRes can come in and understand, as we move the score of the population, how many of them can move from deep red to pink to purple to blue. And all that can happen just by simply looking at the score of a population. The data is fairly out there. Now, to your earlier question, Alex, how does those partnerships really look like? This is how it looks like. We are mostly B2B2C, so all their students, if they have existing mobile applications, you don't have to download a separate application. This is the most important part, being able to tie back the digital journeys to existing product journeys and customer journeys overall to ensure that not only this uptake, but the sustainability of that uptake itself. So that's what we're doing. Happy to take any questions as well.
Questions from the room? I have a question, because in order to be able to provide those kind of services, you have to come up with a huge kind of infrastructure. You have to build up all these puzzle pieces in order to eventually generate products on them and provide them to GenRe or other clients. What about this process of building up and then constantly developing the infrastructure and the product lines? Is that something that happens a lot in collaboration with the large organizations, or you propose that?
So we are a labs. There's a digital health labs. We're constantly churning out products, keeping our ears and eyes on the ground, and of course, going to them and asking that, what do you guys think? Because ultimately, this has to be translated back into a product. So, for example, the diabetes, pre-diabetes journeys came from an idea that, okay, if we understand a certain packet of risk, there's a higher risk of diabetes, can we sell them a diabetes cover? What would the diabetes cover look like? What do we need to track? What kind of journeys the consumers needs to happen? So those are the ways innovation happens. It has to be collaborative.
Well, in terms of product, we are actuaries. I mean, and usually traditional insurance and insurance are full of actuaries. So we design the product. What we are lacking, when you do digitalization, is basically what we call MET, which is metabolic equivalent task. What's the future? We're transforming from what to why and how. So we know the what if something happened, because statistically what happened in the past. But now if we can on real time accompany the client on a ecosystem client-centric approach, we can provide a product for every single, let's say, cluster of people who are alike, and cooperate with someone who can give us this real-time data.
Yeah. Thank you very much, Bashir, Mazen, and Gura.